Hey everybody, this is Tris Mendonez, and I will be presenting my MRI patient safety project. Patient safety. Patient safety is very important, especially in MRI. MRI uses a strong magnetic field and computer-generated radio waves to produce a very detailed image of a patient's body. But because of the strong magnetic field, it can cause harm when prohibited items are near the vicinity of the magnet. These items can be as simple as metal in your clothing creating a burn on the patient, or as complex as a non-MRI authorized wheelchair becoming a projectile and flying across the room. Nonetheless, it is important to take steps to keep the patient safe as well as those around you by properly screening the patients before an exam. The MRI screening form is a form that a patient or patient's caregiver or guardian must fill out prior to an MRI exam. This form provides important questions for the patient to answer to help decide if there are possible problems that should be discussed before entering the MRI zones. We want to prevent any injuries to the patient and to others, so it is important that the patient gets properly screened and that MRI prohibited items do not enter Zone 4 and become projectiles near the magnet. For this particular patient, they're coming in because of neck pain, and they are getting a C-spine without contrast by a 1.5 Tesla magnet. The patient has previously had x-rays as well as right hip replacement surgery and a screw put in their left ankle. The patient is taking insulin and has hearing aids as well as an Accu-Chek insulin pump. Now there are a few obstacles with this screening form: the Accu-Chek insulin pump, the patient's hearing aids, and the orthopedic implants in his right hip and his left ankle. There are two types of Accu-Chek insulin pumps that the patient could possibly have: an Accu-Chek Solo and an Accu-Chek Combo. And according to the Accu-Chek website, you should never use your insulin pump near an electromagnetic field such as X-ray, computed tomography, or MRI. You must disconnect and remove your pump and leave it outside these areas. If you do not follow these instructions, your pump can be damaged and quit operation. There are three types of MR conditions: MR safe, MR conditional, and MR unsafe. MR safe means that the item poses no threat in all MR environments, so it is non-metallic, non-magnetic, and non-conducting. MR conditional means that the item has been demonstrated to pose no known threats in a specified environment with specific conditions of use. And MR unsafe means that the item is known to pose threats in all MR environments. So this would include magnetic items like ferromagnetic scissors. The patient has a hip replacement and a screw in his ankle, but whether or not they are safe depends on the material that they are made of and need to be cleared before the exam. Although I would consider the patient's replacement and screw to be MRI safe due to most implants, especially nowadays, being made of titanium alloys, which is a non-ferromagnetic material that is able to be scanned in an MRI machine. But the Accu-Chek insulin pump as well as the hearing aids are considered MRI unsafe and can cause a threat when placed near a magnet. Not only that, but the MRI magnet can damage the devices due to the powerful magnetic field of the MR machine, and these devices should be removed before the exam. For my plan of action, I would consult the radiologist and confirm that the patient's hip replacement and screw is made of non-ferromagnetic material and that the examination can proceed, although recent replacements use non-ferromagnetic material. I would make sure that the patient removes his hearing aids and insulin pump before entering Zone 4 so that there are no chances for projectiles, anyone getting injured, or that the patient will not potentially receive burns from the metal material of the devices. I would give the patient a rundown of what is about to happen during the examination and to let one of the technologists know if there is something wrong. In conclusion, it is important to keep the patient as well as everyone involved safe. It is important to properly screen the patient, and the patient screening form is one of those ways the technologist is able to do that. The screening form can be used as a guide for the technologist to make sure that there is nothing wrong and can negatively impact the examination as well as harm the patient and others.